Well, this is May, National Lyme Disease Awareness Month, and Lyme disease is really something that has affected a lot of lives here in Rhode Island, across the country, and we have a health expert from the National Association of Pediatric Nurse Practitioners who will offer some important advice. Joining me on the line is Ashley Jura to discuss this health trend, a pediatric nurse practitioner. Ashley, nice to have you with us.
Thank you. Thanks for having me.
Well, it's good to talk to you. This is very, very important, and unfortunately, Lyme disease is becoming more common. Tell us about it.
So it definitely is becoming more common. The Lyme disease cases reported in the U.S. has actually doubled since the year 2000, and the number of counties considered high risk for Lyme disease has tripled in recent years. And this is actually just what is reported, and we now know, based on insurance data, that just because it's reported, there are actually way more Americans being diagnosed and treated every year than are being reported to the CDC.
Just the basics, Ashley. How is Lyme disease spread?
So Lyme disease is spread by a very specific tick called a deer tick or black-legged tick. It spreads a bacteria called Borrelia burgdorferi, and that once that infection is spread to your body, it can lead to skin problems, heart problems, brain and joint problems.
Yeah, it is really devastating, particularly to people who have suffered with it for a long time. What's the information in Rhode Island, Ashley? Which direction are we going?
Absolutely. So in Rhode Island, the latest information we have is from 2019, and in 2019 there are about 530 confirmed cases and another over 400 that were probable cases of Lyme disease. So that puts it at an incidence of almost 50 cases per 100,000 people. And we know that that's only what's reported, and there's probably a lot more that's being diagnosed and treated in clinics at the bedside.
Yeah. What are the long-term effects?
So there can be several long-term effects of Lyme disease. When it's untreated, it can lead to issues of the space in and around the brain, so things like meningitis, where you have fever, headache, sensitivity to light. It can lead to numbness or tingling or weakness in the arms or legs, facial droop on one or both sides. It can actually change the electrical conduction of the heart, so cause a carditis. And in children, one of the most common presentations of Lyme disease on the late side is arthritis. So they'll have a very swollen knee that's painful for them to walk on and painful for them to move.
Now, those are the symptoms that we've really heard the most about. Are children most at risk, or can this affect anybody?
It can certainly affect anybody. We actually know, though, that Lyme disease is most common in children 5 to 9 years old, and it probably is due to how frequently they're outside, playing around in the woods, spending a lot of time in there, and they're not old enough to really do their own tick checks. So that really falls on the parents to be able to check their body for ticks, check their clothes, and gear for ticks as well.
So that's really the key, to beware of those deer ticks and to do a tick check. What's the best way to go about that?
Absolutely. So tick checks means you look all up and down the body for any tiny little ticks that you might see. They can be smaller than a freckle, so really paying attention to all of those little spots is really important, especially around the hairline, the waistline, and the sock lines, because ticks will keep moving until they stop. So all of those areas are the greatest places to look. It's also, because it's so easy to miss, it's good to shower or take a bath within a couple hours of coming indoors. That'll just wash off any ticks that you may have missed before they are able to embed into your skin.
Now, will these ticks latch on like a dog?
Yeah, they will. So they actually have little pincers in the front that will burrow into your skin, and that's how they'll spread the Lyme bacteria, is they'll spread it from themselves because they're an infected tick and spread it into your skin.
So if one has gotten into you, how do you get it off?
If one's gotten into you, yes. I know. You hear all sorts of things from different people. So there are some folklore tales which are not recommended, such as burning it off. Please do not do that. Or painting the tick with nail polish or Vaseline. Very common folklore remedies. The best way to remove a tick is to take a pair of tweezers, get as close to the skin as you can, and pull upwards in a really nice, steady, slow motion. The more slow and steady you can go, the better chance you have of getting those head parts out. If they do stay in, if the head breaks off, that's okay. It'll come out eventually.
Gotcha. We're talking with nurse practitioner Ashley Fiora, who is a specialist in pediatric infectious diseases. We're talking about Lyme disease spread by ticks. So if we suspect that, particularly our child, has been bitten by a tick, what should we do immediately?
So the best thing to do immediately, if the tick is still there, is to remove the tick. So grab those tweezers, slow and steady, up and out of the skin. Once that happens, a lot of the time you can call your primary care provider. They may want you to save the tick so that they can identify it. They won't test it for Lyme disease because that's not as helpful as people might think it is, but they will help identify the tick. And there is actually some medication that they can give you if they are worried that it's a high-risk tick bite. And then after that, you'll just have to watch for symptoms of early Lyme disease, such as a rash. Yeah. So about 70 to 80% have a rash called erythema migrans. That rash can start as a circle. Sometimes it looks like a target, doesn't always look like a target, and it'll expand. It's kind of a flat red rash that expands. Along with that, they could have fever, chills, headache, muscle aches, and swollen lymph nodes as well.
Does it mimic other diseases, or can it be mistaken for something else?
Absolutely. The rash, like I said, it doesn't always present in that classic target appearance. So sometimes it can be really hard to identify the rash. And, fever, chills, and headache, muscle aches, those are things that kids have very frequently. They get a lot of viral illnesses. So it can absolutely be mistaken or missed. Just making sure that, both parents and families have that in the back of their mind. If they live in an area like Rhode Island, that they know they have Lyme disease, they know they were outside, maybe they know they removed a tick, making sure they communicate that to their healthcare provider is very important.
All right, nurse practitioner Ashley Fiora, what a lot of information in just in time, really. Where can we go for more information?
Absolutely. You can go to napnap.org/napnapknowslyme for more information.
Excellent. And NAP is National Association of Pediatric Nurse Practitioners, NAP. I got it.
Absolutely.
So good to talk to you. Thanks very, very much for a lot of information today. All the best to you. Thanks for being with us.
Thank you.
And nurse practitioner Ashley Fiora was sponsored by the National Association of Pediatric Nurse Practitioners.